got it.
No,
What to do?
No, take it. Don't take that.
So Carson is this adorable 3-year-old boy.
Well, I love to describe Carson as like 3 kids in one.
That's a good one. He is high energy. He is full of life. Ammon turn.
My turn.
He'll do like some goofy stuff like climbing on our backs. Giddy up, daddy. Goofy stuff like that. He's just a ball of energy. He's very funny as well. And if you ask me if he's, do you know that you're funny? He's like, yeah, I know. That confidence in himself is second to none.
Who's a handsome boy? He will just say the funniest things just to make me smile.
If you take time and observe Carson, you'll laugh every time.
You don't want to see him dance? Oh yeah, once there's music, he is going to have a blast and he's going to party. Carson loves to play with his brother, Ammon. He's just a very caring child, very loving child, just absolutely adorable. Are you ready? So when we were told that he was sick, we were shocked. We were like, this can't be real. So everyone was shocked, to be honest, because he's just this child that just bounced off the wall.
I really don't know how to explain it because it is frightening to me.
What lives up here? Ooh, can it be? What do you think is in there?
Certain treatment that he has to go through. I wouldn't wish it for my worst of enemy.
My name is Tehani and my son has neuroblastoma.
Neuroblastoma is a pediatric malignancy that arises in cells that are derived from cells in the primitive nervous system in the developing fetus. Neuroblastoma can occur anywhere along the migration path of those cells, and they typically end up in the adrenal gland in your abdomen. But you can see neuroblastoma anywhere along what's called the sympathetic chain, in the neck, chest, abdomen, or pelvis.
One night, I was outside in the living room, and he was in the bedroom with my wife, and I heard him start coughing unstoppably, like the ongoing cough throughout the night.
And he was just not looking himself, so I just quickly rushed into the doctor. And because of the ongoing cough, they did a chest x-ray to see what is the nature of the cough, what's going on his chest. They realized that there's some abnormality on the chest x-ray.
Neuroblastoma forms as a solid tumor, and so children will present with symptoms related to where the tumor is in their body. So if they have a tumor in the abdomen, which is the most common site of neuroblastoma, they may have abdominal pain, constipation, issues with appetite, that sort of thing. If it's in the neck, they may have a lump or a bump. If it's in the chest, it can sometimes cause issues with breathing.
In order to get the right diagnostic, several tests were performed. So a CT scan was done, bone marrow biopsy, MIBG scan, and an MRI.
When they found out he had a mass on his chest, he was 2 years old.
When we learned of Carson's diagnosis, we were shocked. It seemed basically surreal. We're just kind of just waiting to hear the good news, because like this is a healthy child.
It is indeed a shock when a child is diagnosed with a malignancy that most people haven't heard of and probably don't know anybody who suffers from this disease. So sometimes they feel kind of alone at the time of diagnosis.
With neuroblastoma, there's low, intermediate, and high risk. Carson was initially thought to be intermediate, but then after further testing, it was determined that he's actually high risk.
Neuroblastoma is really a fascinating disease because there are children, very young children in particular, in whom neuroblastoma will go away on its own, and they don't even require any treatment. There are also children where surgery is the main treatment for the disease. And then there are children who need very intensive treatment with chemotherapy, surgery, radiation, high-dose chemotherapy with stem cell rescue, and immunotherapy.
The side effect of neuroblastoma treatment is very nasty. For the first phase, which is chemotherapy, it is nausea. It is watching your child hair fall out to where it's completely bald, no hair on his head, no hair on his lashes, no hair on his brows. That was hard to watch. For the bone marrow transplant, that one, the side effect of that one is the worst. For some parents, I'm going to be very graphic here. With that treatment, your child is vomiting blood for several days. When I first saw that, I pressed the panic button. I'm like, I need somebody in here right now. And when they came in and they're like, unfortunately, that is normal. I'm like, there cannot be anything normal about your child vomiting blood. Yes. Can you close your eyes for prayer? And say your prayer? When Carson is praying at 9, he says, thank you for all the people that love me. This is a 3-year-old.
Yeah.
Your family. And then he goes on to say, thank you for Jesus Christ and doctors for making me all better. And so when I hear those things coming out of my little 3-year-old, it just gives me hope.
So Carson's really had a rough time at different points during his therapy. He has family back home in Jamaica and some family here in the Philadelphia area. So on top of getting through treatment, there's been time and space and distance that's complicated things. He has incredible parents and a lot of family support, and I think that's been crucial in getting him through the rough times.
How are you feeling? You're feeling okay? Carson's supposedly in the last phase of treatment. This phase lasts about 6 months. With this treatment, a lot of kids do relapse at some point along the journey. So it's just gonna be completing the immunotherapy treatment and then watch and see kind of a thing.
So what are you gonna draw? Ammon is a champ. I mean, when Carson is down, you know, we can count on Ammon to bring back his energy. Those two is like opposite, but some way, somehow they feed off of each other's energy. Just to watch them corresponding and, you know, being around each other, it's amazing how they can be an antidote for each other.
The progress that we've made in the last 20 years in improving outcomes for children, especially with high-risk neuroblastoma, have all been made through the process of clinical trials. So if investigators and laboratory scientists have an idea for a new drug or a new treatment, we have to know if it really works in children. And organized, well-designed clinical trials are the way that we're going to make things better.
What helps me through this journey, I take pictures of Carson every day. I keep a journal for him. I do a lot of self-care, like with art and stuff like that. This is a hard journey. It sure is. There's no sugarcoating it. However, there are people There are resources there to help support you along the way. And you just have to take it one day at a time. Do not try to bite off too much. Do not try to read too far ahead. How much do I love you?
Big?
Big?
I love you big.
You love me? You love me big enough?
Yeah.
Okay. And so the journey that could have been a very hard one has been a little lighter than it could have been, just because Carson has just been carrying me. Even though he's the one going through this, he has been basically carrying us through this journey, through his laughter, through his energy, through his smile, through his wit. And let me tell you, he's very witty. Yeah, he is. What does it say? Uh-huh. Mm-hmm.
Alright, okay. Ready?